Hello and welcome to Vet Neurojar, the podcast where we explore the fascinating intersection of veterinary medicine and neurology. Today, we're diving deep into a recent study that highlights the importance of eye exams in pets undergoing ear surgery. Specifically, we will discuss total ear canal ablation and bulla osteotomy, or TECALBO and VBO procedures, and how these surgeries can impact the eyes of our feline and canine companions. These procedures are often necessary to treat severe ear problems, including chronic infections, polyps, and masses in the ear canal. While they offer a high success rate in resolving ear issues, these procedures are complex because of the important anatomical structures located nearby, including nerves and blood vessels, such as the facial nerve, sympathetic nerves, and the carotid artery. We will explore the findings of a study by veterinary ophthalmologists at The Ohio State University and MedVet Columbus. This research underscores that thorough eye examinations before and after these ear surgeries are not just recommended, they are essential. Let's begin by understanding why these surgeries are needed in the first place. The ear canal can be a source of chronic discomfort for both cats and dogs. When medical treatments are not enough, a TECALBO or VBO becomes necessary to resolve issues like chronic ear infections, the growth of polyps, and even tumors in the ear. These procedures aim to remove diseased tissue and promote healing. The surgical procedures, whether a total ear canal ablation, TECALBO, or a ventral bulla osteotomy, VBO, involve removing the ear canal and addressing the middle ear. While these surgeries are often very successful for managing and resolving the primary ear disease, they are not without risk. As you can imagine, the area surrounding the ear is a crowded space containing many nerves and blood vessels. This is why there is a risk of complications, with reported complication rates ranging from 29 to 82%. This brings us to the heart of the study, the high incidence of ocular and neuro-ophthalmic complications. This study was designed to evaluate what kinds of eye problems occur before and after these procedures. To conduct the study, researchers performed complete ophthalmic examinations on dogs and cats that were undergoing TECALBO or VBO procedures. These exams were performed before surgery, 1 day after, 2 to 3 weeks after, and then again 2 months after, if necessary. They evaluated a range of issues such as facial nerve deficits, which include muscle weakness or paralysis, Horner syndrome, Keratoconjunctivitis sicca, or dry eye, and corneal ulcers. The study included 28 dogs and 22 cats undergoing 43 TECALBO and 20 VBO surgeries for a total of 63 affected ears. The most common reason for surgery was otitis, followed by polyps and oral masses. Before we delve into the specific findings, let's discuss what these ocular complications mean. First, facial nerve deficits, resulting in drooping of the lip or ear, and reduced or absent blinking, are a common finding. The facial nerve controls the muscles of the face and eyelids, so any damage to this nerve during surgery can lead to these kinds of issues. Horner syndrome results from damage to the sympathetic nerves and is characterized by a drooping eyelid, constricted pupil, and a sunken appearance of the eye. Keratoconjunctivitis sicca, or KCS, is a lack of adequate tear production resulting in dry eyes, and can lead to discomfort and corneal problems. Finally, corneal ulcers are open sores on the surface of the eye, which can be painful and vision-threatening if not addressed. Let's look into the data, and how it breaks down. The researchers found that preoperatively, 24% of the animals had some type of ocular or neuro-ophthalmic abnormalities. Additionally, 32% were diagnosed with an ocular issue that was not related to the surgery. Following surgery, a significant 64.2% of surgeries led to some type of eye or neuro-ophthalmic issue. Facial nerve deficits were the most common neuro-ophthalmic finding. Before surgery, 5.7% of the patients had facial nerve deficits, compared to 47.2% of patients 1 day after surgery. At the 2 to 3 week follow-up, 31.3% of patients still had deficits. Dogs seemed more prone to this complication. While only 13.6% of cats had these deficits 1 day after surgery, 78.6% of dogs showed deficits at the same time point. By the 2 to 3 week check, all cats had recovered, while 70.8% of dogs still displayed deficits. This suggests that cats tend to have these deficits for a shorter period of time. In many cases, the facial nerve deficits are transient and resolve in 2 to 4 weeks, but permanent facial nerve deficits are reported in a percentage of cats and dogs. This shows the importance of early and ongoing care and observation. Horner syndrome was also a major finding, with 11.3% of animals affected preoperatively compared to 45.3% 1 day after surgery. At the 2 to 3 week mark, 37.5% were still affected. Cats were much more likely to suffer from Horner syndrome than dogs, with 90.9% of cats showing it at the 1 day follow-up, compared to only 10.7% of dogs at the same time point. Interestingly, the study found that the presence of polyps was significantly associated with the occurrence of Horner syndrome in cats. This makes sense, as the sympathetic nerves pass through the middle ear, where polyps are likely to be present, making those nerves more vulnerable to surgical trauma. The study highlights that cats are more likely to have this complication because the nerves of their middle ear are more exposed and vulnerable to surgical trauma. Let's move to other ocular issues discovered by the research. Keratoconjunctivitis sicca, or dry eye, was noted in a small number of patients, with 5.7% at the start of the study and postoperatively, with only one additional patient diagnosed at the 2 to 3 week follow-up. Corneal ulcers were present in 3.8% of patients prior to surgery, with 17% developing them 1 day post-surgery. The study also observed a decrease in tear production immediately after surgery in both cats and dogs, but found that tear production returned to baseline by the 2 to 3 week check. One patient with preoperative facial nerve paralysis and Horner syndrome developed a serious corneal issue that required a conjunctival graft. This single case illustrates the importance of careful monitoring of these cases. Now let's discuss some of the factors associated with these complications. The study found some interesting links, especially regarding facial nerve deficits and Horner syndrome. These two conditions were significantly associated with the species, with cats more likely to have Horner syndrome, and the surgical procedure performed, specifically TECALBO, as well as the reason for the surgery, with a higher occurrence related to otitis and polyps. The study did not find any association between the development of ocular complications and factors such as sex, the presence of oral masses, whether nocita, a local anesthetic, was used, or which surgeon performed the procedure. The research also looked at whether longer-standing ear disease would increase the likelihood of ocular issues. However, they found no association between the duration of ear disease and the development of ocular problems. The researchers did notice that dry eye, or KCS, was associated with otitis. Age was associated with the development of Horner syndrome on the left eye at all follow-up time points, and age was also associated with the development of corneal ulcers on the right eye at the 2 to 3 week follow-up. This study brings to light some crucial points. The incidence of facial nerve deficits in dogs was much higher than previously reported. Researchers attributed the higher detection rate of facial nerve deficits to the fact that complete ocular exams were performed, including assessing eyelid function, blink reflexes, tear film quality, and overall corneal health, which allowed for the diagnosis of subtle signs of facial nerve deficits. Similarly, the study identified a higher incidence of corneal ulcers than previous studies, which was likely a result of the increased rate of facial nerve deficits. The authors note that the corneal ulcers may also have resulted from other underlying issues. The researchers emphasize that these ocular complications are not trivial. They can lead to significant vision-threatening issues, including corneal perforations requiring additional surgery or even enucleation. In light of the risks discovered, the authors emphasize that all pets undergoing TECALBO or BO procedures need thorough pre- and post-operative eye exams by veterinary ophthalmologists. This type of exam includes a comprehensive evaluation of the tear film, the corneal surface, and the function of the facial nerve. The study also supports the use of tear lubricants in all patients undergoing TECALBO or VBO, until the normal tear function and blink function have returned, and especially in patients with facial nerve deficits. Temporary tarsorrhaphy, the partial or complete suturing of the eyelids together, should also be considered for patients with facial nerve deficits, especially in brachycephalic breeds, which are predisposed to ocular surface exposure. This research offers valuable insight into the importance of a collaborative approach between surgeons and ophthalmologists when caring for these patients. By recognizing the high incidence of ocular complications and employing thorough examinations, these patients can receive comprehensive care to prevent or quickly address complications that could affect vision. This study shows that while these surgical procedures are beneficial in resolving chronic ear issues, they come with a significant risk of ocular complications and should be approached with care. The study did include some limitations, one being that they did not have exact time frames for the onset of the oral disease, relying instead on information provided in the medical records. Additionally, some of the initial exams were done after the patients had been sedated, and some data was missing for STT and IOP measurements. Finally, they noted that follow-up visits were difficult to standardize, and data was lost in part due to the fact that patients were seen by different doctors at multiple locations. The study makes it clear that a combined approach between veterinary surgeons and veterinary ophthalmologists is crucial. This research underscores the need for meticulous postoperative monitoring and the importance of early intervention to protect the vision of these patients. That's all for this episode of Vet NeuroJar. Thank you for joining us as we explored this fascinating and important study. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.